Okay, everybody, let's start. In previous weeks, in this weekend, the last one we had, I sent you the slides from classes 7 and 8. So you got this material in order to check and answer your homework, the fourth one. That's why we are going to see the vocabulary, the abbreviations about medical practitioners, general practitioners, well, everything you were checking, I think, during this presentation. And of course, we are going to be clear on this, just going to the point, in order we really need it. So in that way, let's start. I think it's a good moment to do it. If the session, if the Zoom has a trouble, of course, we are going to talk by the WhatsApp group, okay? Because something is strange tonight with this, but don't worry. I think it's corrected now. Give me a second, please. Give me a second, please. Okay, it's done. I'm sorry, it was someone. Yeah. Okay, let's go ahead. Well, as I was telling some of you in the last workshop, these two last theoretical classes are with lots of terminology, terms, talking about medical practitioners, nursing, and allied medical professionals. Just a general view, of course, because there's too much information when we consider all of these details. But going in a general view, it's possible to make it. And you have a plus. You got the slides previously, then other times I sent the same presentations. So I think you had the chance to check these presentations for preparing your answers, as I was telling you 5 minutes ago. So let's go ahead. You got now an idea. We're going to review this. We're going to finish at 9, as it usually happens. Medical practitioners 1. Here we are checking some specific details that we must consider when we talk in English about doctors, about medical professionals, healthcare providers, right? A medical practitioner, of course, is a doctor, but a doctor that must be qualified. I mean, have a university degree in medicine in order to practice. If you don't have that capability, a doctor, of course. That's why we have similar registers, school, right? In that order, with all of the details you must consider. Going into definitions, a clinician is a doctor who develops research activities and treat patients. I mean, when we talk about doctors, medicine, all of these careers, we all, nobody, the place you work, we all make research in an indirect way, we can say. We have this activity in our career because of the procedures we develop, the information we get, how we must become up to date all the time. So it's it's possible to understand that everybody makes research because we follow protocols, we follow rules for working. But a clinician is a specific doctor who gets prepared, who studies for being a part of research, or being into a specific group and a specific company maybe, to collect information and prepare results in order to study new medication, vaccines, the epidemiological movements, I don't know, that kind of things. That's why not all doctors make research. We all have the capability, but not all send information supporting that kind of activity. That's a clinician. That's why not all general practitioners become clinicians, because you need to be prepared on this. During the whole module 1, we were talking about the GP, the general practitioner. In countries like USA, Canada, and Europe in general, the general practitioner is the first one and is the one who provides primary care. I mean, at this point, I'm a general practitioner, so if I were in that places, I would be providing primary care. I would be there. But in our countries, it's different. We have the chance to get prepared on specific areas, and then we have the chance to continue our activities considering these places, different places from primary care. And GPs work, well, the general practitioners, we work in a group practice. I mean, we don't work alone. General practitioners always has to be into a group. At least the doctor, the GP, the nurse, and then they are with the rest of the administrative staff. As a general view about specialties, well, we must consider that a specialist generally works in hospitals because they are prepared on a specific branch. We all know about it. We all have the idea. We all get this information, and we might consider that it's the most common situation. Usually, specialists have the chance to develop private healthcare. I mean, they have consulting rooms outside the hospital, so they have the chance to treat patients from, well, by their own. As a general view in medicine, we all know that we have two principal branches: surgery for surgeons in general, and internal medicine for physicians. I mean, I am a GP, a general practitioner. I have to develop, I have to be into the residency course in internal medicine, and while finishing, I become a physician, right? The internist, yeah, it could be making a colloquial translation. Of course, internist is not a term. Internist is not a meaning. It's just a joke. But the internal medicine doctor, the internal medicine specialist is the physician. Not all the doctors are physicians. We get in confusion because of TB or series where everybody has the PH in clothing, in the scrap, but no, the correct term is physician for internal medicine specialist. In our group, we have a specialist, a physician, a good doctor. So her specialty is different, the way to work, right? About names of the specialties, they usually end or they usually finish in ology because of the study of, we'll know the meaning. Name of specialists usually end in ologist, the one who makes this activity or the one who studies this branch, the specific branch. The name of a specialty ends in ICS. You can see, for example, orthopedics, pediatrics, obstetrics. And the name of a specialist is in Xian or Xian, for example, surgeon, physician, right? Just for oh, I'm sorry, just for considering that they need to be in a good way of handwriting. I mean, the good way to identify this, but just a detail. What about choosing a specialty? Of course, it's not an easy fact, because during the medical school, we have the chance to take a little piece of all of the most common branches. And according to that, we have the chance and we have the opportunity to check patients with many different situations. In that order, while finishing the medical school, start working maybe, we have to consider that all of these specific branches, specific activities are very different one to the other. So we have to think on this. We as general practitioners have to consider that there are many ways to choose a place where I develop my best, where I am doing it good, right? This chart, this slide is just for having fun, just for maybe smiling a little bit and considering how interested I'm in a specific branch. So what's the problem? How are your grades? And according to those questions, you have maybe an idea what to look for. In my case, a personal case, I was checking this a long time ago, and I get here because I'm hyperactive. So I really need to stay in movement. But, well, patience. Following this chart is so fun. Read it for having fun, for maybe considering something different. And according to that, thinking on what you really want to do the rest of your career, maybe could give you an idea. But it's just for having fun. Of course, you have the specialties in blue. And that's a little bit of vocabulary to consider, okay? Well, I decided to divide medical practitioners 1 and 2 because of the practical definitions. That's all. Medical practitioners 2, we are considering as a group while working. I mean, we have to consider our staff. The staff when we work is nice, I mean, because we all have the same objective, to help our people. But staff as a word means people who work at any type of workplace. I mean, we have the hospital staff, the airport staff, the hotel staff, I don't know. But the hospital staff, we all are focused in helping people. We are focused on giving solutions, right? But going specifically to the medical staff, the group of doctors, yeah. We have all of this chain, all of these people just in one group. I mean, looks like too much, but certainly it isn't. Going from the basis, we have the medical student, the one who's at the medical school, who's still getting prepared. From the first year to the 5th one, usually that's the period of time that it takes, when receives all the theoretical information and details and some practice. While finishing the medical school, you become an intern, the last year of career, usually when you go to develop the social service, and usually in lands. The intern is not a doctor at the moment, is a student that is still being prepared on these activities, but according to the place you study, you have the chance to develop or to practice your medical thought, your medical ideas, and to show how well you make it, we can say, and maybe choose your specialty. While being an intern, of course, you have lots of responsibilities. One of them is to help the medical students. According to the place you work, you work and you study, you have the chance to finish the internship and then go directly to the residency course. But I'm telling you, it depends to the place you work, you study, you live. It's not the same for everybody. Here in Latin America, I think, as a general view, we finish the internship, we become a general practitioner with all the registers, and then we have the chance to become prepared to take the test for becoming a resident, to take the residency course. According to the specialty, you have the chance to go from 2 to 7 years. Maybe you need to become at the beginning an internal medicine resident, a physician at the beginning, and then go into the specific area. For example, nephrology could be, or cardiology or pneumology. It depends on the place you develop your activity. Of course, there are so many years being a student again, and while finishing this, you become a specialist. But this specialist has a period of practice that is supported by an institution according to the place you are. For example, UK, Australia, and USA have that program of studies. And then you become a fellow, a physician, a specialist, who's in the post-residency training, 2 years when they perform specific activities like a specialty, and a specialist, and then you have the chance to become an attending. The attending is we can say the responsible of the service maybe, but is the one who's the professor of all of them, the oldest, not in age, in experience, in practice, being into the hierarchy line. That's the biggest one, the best prepared, we could say. For example, checking Dr. House as an example. Dr. House was the attending. He had fellows. The fellows maybe had a resident, and then students we never watched there. But a good example of who's an attending is Dr. House, could be. It's in the American order. In Bolivia, in Latin America, the attending could be the chief the chief of the service, or service chief, I don't know. For example, in surgery, the chief surgeon could be the attending, because it's the best prepared surgeon, and then the surgeons, the rest of the surgeons are the fellows, and the fellows are the residents, and that's the chain. So as a general view, it helps, but we have to fit this hierarchy according to the place you live, you work, or you desire to stay. There are some staff hierarchy hospitals in different parts of the world, just for showing you that we have many different places, many different ways to organize our services. But we have to take it in account. Surgeons, in general, always are the top. Why? Because a surgeon, the one that has the capability to cut the body and solve a trouble, is very well prepared and has the different opportunities to develop worldwide protocols. I mean, trauma protocols or that kind of activities that in a kind of specific situations, they rule how the rest of doctors work, how we must develop for being prepared in our best. Then become normal specialists. I mean, clinical specialists, for example, physicians, psychiatrists, ophthalmologists, people that is, of course, very well prepared, but they together, surgeons and clinical specialties, support each other to prepare these protocols. Silent doctors are usually residents or doctors that are still on preparation during the residency course years, in order to become the job easier for our boss. Yeah. for the specialists, and they prepare all the information. Then we have nursing. Nurses are amazing. I mean, without them, we cannot develop our activities and continue with treatments. Then we have the physician assistant. Physician assistants are that doctors that are into the hospital helping the silents and the specialists organizing all the information, clinical histories, developing specific studies, moving patients. Physician assistants are without a register, cannot take a decision by their own, but they move everybody. And then the medical student or interns, according to the year, everyone is in there, okay? So it's a good way to consider this. The Australian hospital hierarchy is different. Of course, we have the senior medical officers. When they have a general practitioner at the top, because it's the one who has a general view of everything, between quotation marks. And then we have all of these staff specialties in general and career hospital doctors. I mean, doctors that just work at the hospital. Then they have visiting medical officers, people who's prepared just for making primary care, the registers, people who's prepared just for working with all the information, organizing data, the principal house officer and resident medical officers. They develop activities with specific students. I mean, senior house could be the last residency course student, and the junior house officer is the doctor that is starting the residency course, and they have to support the interns into the hospital. As a general view, the physician hospital hierarchy in Latin America, because it's not in a specific place, could be like this. Very similar to here, right, to Bolivia in this case. Considering that the chief resident is, of course, a resident, is the well-prepared. The first year resident, second year resident, third year resident, and resident as a fact is the one who goes to land in the social service for a year, and then they are supported by a fellow. This fellow is supported by a hospital and house staff. And this hospital is attended by attending physicians, I mean the chief on service, okay? Just as a general information, so no very important, I think. About medical teams, we all know we have the chance to consider that in a medical team, of course, we have a group of junior doctors to help care patients of the consultant physician and surgeon. I mean, in hospitals, we have in Bolivia the ward, the shift. In that shift, we are teams. In that team, almost all of us are juniors. I mean junior because you are not a resident. And you have to go and check everything from all the patients and get with the correct information to the specialist about his patient. When it's just team, medical team, it's just for doctors. When we talk about many other branches, we have to consider multidisciplinary teams, groups formed by doctors and allied medical professionals. Not just doctors, maybe a physiotherapist, maybe, I don't know, nurses, that kind of different professions that help to take care of people, to take care of our patients. And check this paragraph, it's very important because we have lots of vocabulary and expressions when we talk about patients that are getting into the hospital. When a patient enter, or when patients enter or are admitted to hospital, they are usually seen first by one of the junior doctors, I mean general practitioners, on the ward or shift, okay, where they will receive treatment and care according to the situation. If it's possible, we make it. The junior doctor or the general practitioner clerks them, I mean, takes their medical history, collects all the medical information, and examines them with the bell of the physical exam. And according to that, sometime later, the register also sees the patient. We could say the resident also sees the patient. The resident may also order some investigation or tests, for example, X-rays or ECG, and make a provisional diagnosis and begin the treatment. That's the difference. In Europe, you say when you are a junior doctor, just a helper, you don't have the chance to develop your medical thought, you don't have the capability to develop your diagnosis or even though the treatment. You have to follow the specialist information, the specialist orders. In Latin America, we start as general practitioners with everything, and then we get in contact with the specialist following the results. Well, when we start the treatment, then the consultant usually sees the new admissions. I mean, the specialist that is on shift usually sees the new admissions. People who have recently been admitted to the ward, the ones that are expecting in the emergency room maybe, and the specialist is coming to evaluate them. For the first time, one regular ward rounds. We all have the experience to be into ward round. I mean, it's a very stressful moment, very stressful situation, because you go to check all the patients. You can say the ward round when the management of patient is discussed with the register, with the resident, could be said. Consultants or specialists also decide when a patient is ready to be discharged, is ready to go home. On the ward round, the consultant is accompanied by a team and a nurse. You check the team that was in the previous and the nurse. And they visit all the patients in the consultants in the specialist care. I mean, we all have this experience. We have some students into this group, so you might have your own experience. And it's very interesting when the specialist make a question to the resident and the resident is not sure. Usually the question jumps to the next one. Could be, I don't know, another resident from another younger resident, or maybe to the intern. If the intern is not sure, then the question jumps to the medical student. So, there's a chain we have to follow. Talking about shifts, of course, a medical shift is one in which the schedule is rotating in hours and days previously agreed. Because we all have a personal life, we all have to organize these moments while working and staying at the hospital. And it's according to the place. You can stay there for hours, you can stay days. It's different in every country. Let's talk about nurses. We have a nurse into this group. If there's a mistake, please correct me. There's no trouble on this. Of course, nurses have grades. The student nurse, a nurse who's still in training, we all know about it. Then the staff nurse, a nurse who has completed the training course, a charge nurse, a more experienced nurse who is in charge of, who takes care of or who's responsible for a ward, a shift, or department. And the nurse manager, the boss, the big one, a nurse who's in charge of several wards. Usually the nurse manager is the one who organizes all the roles, all the shifts, all the activities. If you need to exchange a day or some hours, you have to talk to the nurse manager, and then she decides. In these pictures, I'm showing you something, well, a very important detail, because as you know, during the world wars, the first and the second, at the beginning, the nursing role was developed by sisters, I mean by nuns. That's religious women who are devoted, and develop these activities, religious activities. When these wars were finishing and there was no other choice to go back, that nurses decided to teach their profession to levels, to the rest of the people in community. But while becoming a nurse at that moment, people, because of the history, used to call them mother. Mother, no matter if you were a nun or not. You were mother if you were working in a hospital. That's why elderly people, until a few years ago, I think, used to call mother to nurses. Now everybody's nurse, right? That's why we have this picture here. An historical support. About nurses, of course, we have lots of activities we must consider. For example, the support workers are the nurses who have done a short course and obtained a basic qualification. They could be nursing auxiliary, the one that assists nursing staff, or the ward clerks. These ward clerks are the ones who make sure that patients' notes and information are up to date and answering the telephone. I mean, in many countries, for example, in Europe, you have a specific nurse who just collect information and answer the phone. No other activity. And when the doctor finishes working on a clinical history, the ward clerk goes, organizes all the information, and ensures that everything has its own signature, that everything is done, that it's not missing results, lab results, or reports, maybe. That's a ward clerk. Very important, in my opinion, but well, it's according to the place we are. About the specialization, according to the place you work and live, nurses can become midwife. I mean, the ones who are prepared in the management of pregnancy and childbirth. I mean, they don't develop these maneuvers of a childbirth, but they recognize when pregnant woman starts in this period, critical period, and then they support that they really need medical attendants, assistance. Then they have the district nurse, the one who visits patients at their homes. They are specialized in going and making this primary care job, I mean, and it's possible to make it. And then they have the health visitors. They also go to work into the community, but they go home. They go checking people, I don't know, healthcare centers, giving advice on the promotion of health and the prevention of illness. Promotion and prevention. Then the nurses' roles. Well, we have to consider that, of course, they have general roles, general activities to make, like checking temperature, I don't know, pulse rates, well, vital signs. Maybe changing dressings, maybe giving injection shots in order to make it faster, right? But in countries like Japan, France, UK, nurses have the chance to remove sutures because they have a certificate. When they are prepared to do this, they prescribe drugs, they order laboratory tests, the basic ones. They are getting more responsibility through the time. In some countries like Australia, I'm sorry, they remove cysts and take biopsy pieces, but of course not very complicated places, maybe from the skin. But they have the chance, and the nursing role is changing. The responsibilities are going up. I mean, it's too much, but that's a different way of working, right? Well, that's just a chart for showing the hospital nurse hierarchy, but it's just an example. And then let's talk a little bit about medical professionals. All the professionals who develop healthcare activities are allied medical professionals because they are not doctors. They are not nurses. They are people who have a different profession that is related to the healthcare. We have the community health as a general view. Into this group are the physiotherapists, the physios. They help people to move by getting exercise or treating their body with the heat or massages, manipulating muscles and joints with the hands. That's a massage. So you can see a physiotherapist helps you to get in exercise, they treat body, and they improve these capabilities, the normal ones. They help you to avoid chronic pain, for example, or you follow some sessions to improve your movement, your strength. Okay, that's great. That's a physio. The occupational therapist, the OTS, they help people with disability. That's the huge difference. Physios work with, we can say, sane people, with non-disability, the disability people, and occupational therapists just with disabilities. I mean, they help people to develop, to perform tasks at home and at work, with the objective to prepare them for having a better kind of life, I mean, a better lifestyle, or moving or acting by themselves in the best way as it's possible. For being clear, a disability is that physical or mental condition that makes it difficult to live normally. For example, blindness or deafness. Of course, for them, it's not easy to live in a normal way nowadays. But with the OTS, they have the chance to perform, to improve their own abilities, and then get introduced into the social life without a bigger trouble, right? We have a handicapped man, we have a lady who's without the capability of moving legs, this guy with a strange device. So consider this. Of course, we have to talk about the social workers, very important at this point, because they help people to solve their social problems, for example, housing, unemployment, family problems, maybe a teenager, adolescent that is pregnant, a teenager pregnancy, then maybe violence situation, maybe, I don't know, lots of non-kind situations for our patients. They are prepared for making interview, reorganizing the way of living of the patient, and they are the responsible for looking for extra help. I mean, donation, maybe they could help them to find a job in an institution that is supporting this kind of problems. Well, it's a very big branch to talk about. Then there are the chiropodists or podiatrists that they treat conditions affecting the feet. They treat all of the details that maybe could be lost, okay? Maybe could be lost in feet, and they make prevention, lots of prevention about diabetic foot, for example. That kind of situations, they are well prepared, but they are not doctors. They could be technicians, well, it's according to the place. Then we have the technicians in general, X-ray technician, for example. That's people who work with scientific equipment. I mean, they know how it works, they know how hard it is. Well, we only have to take care of them. Then we have the ambulance technicians. They work on the emergency room, on the emergency medical service. By then, don't have the chance, they don't have the capability to leave the ambulance, for example, and go for assisting people. They are not for that. They are in that place just for driving the ambulance. Then we have the paramedic. The paramedic is the ambulance technician with more advanced qualifications. I mean, these ambulance technicians can keep on reading, studying, and become a paramedic. The paramedic is the one who goes to the place, evaluates the patient, controls the situation, and decides if the patient needs to go or to the hospital or stay. If the patient really needs to use the ambulance, or maybe might send them in another kind of car, or I don't know. They are prepared on that. It's a full career, and we have lots of courses, international ones, that show us how to be prepared on the pre-hospitalian assistance. Then we have the prothesist or orthosist. They are the ones who provides care to anyone who needs an artificial limb. I mean, they prepare these structures according the specific size of the patient, according the necessities, according the situation. They not prepare the standard equipment. These prostheses or orthoses, they are for rehabilitation just. I mean, helping patients return to normal life and work after a treatment. It's an objective to work in that short period of time, but it's possible to make. The ones who develop spleens, cast for removal, artificial limbs, prostheses, or orthoses, okay? The opticians. Opticians are the ones who have the chance to develop the test eyesight and prescribe glasses. So they have the chance to make this eyesight glasses, and they develop, or they make the examination of the intraocular pressure, and they check the retina. If there's aspect of any eye disease or eye, or I don't know, an infection maybe, the patient is referred, or the patient goes to the general practitioner, and then the general practitioner If he considers necessary to make it, well, he refers the patient to the ophthalmologist. The ophthalmologist is the doctor, well, the one who developed the medical school, make the residency course in ophthalmology, and now is an ophthalmologist. So opticians, for getting clear, can evaluate the eyesight in a general view and can send glasses, spectacles, contact lenses, that kind of material for improving our eyesight. But the ophthalmologist, of course, that specialist is the one who works on diseases, on infections, on illness in eye. So they are different. You can notice this. So while checking this is the phrase we got. Practice is the price of mastery. Whatever you practice over and over again becomes a new habit of thought and performance. So taking into account, practice on this, keep on reading is very important, I think. So check all of this information. We are still on time for our homework. The fourth file, when you have lots of these terms into the support of the file. And well, that's all for tonight. Let me send you the poll to take attendance, okay? Can you all watch the poll? Okay.
I'm sorry, Miss. Today we're going to send homework 3, right? For both of us, both of number 3 and 4.
3 and 4, both of them, please.
Okay.
We are still on time, so I think we can finish this without any trouble. Any other question, maybe? Okay. Oh, I need 3 people more. Well, I sent the slides to the WhatsApp group. I think you all got it. So the ones who fill the pool can leave the Zoom call. That's all. That's all. They're very short presentation. Not too much. Keep on reading, keep on practicing. Now is the chance to make questions. Tomorrow we have our last workshop. We have our last personal time during the module 1 in order to get all the information for the test. Tomorrow make as much questions as you want, because that's the last opportunity you got. So don't worry, do it. If you are preparing, checking homework files, 1 to 4th, you are sending to me. If you wrote the case report with me last week, if you had the chance to prepare all of this material, you can notice that the test is going to be a piece of cake. It's going to be very easy. In general lines, about the abbreviations, I usually just consider the ones that I sent during the homework. I mean, matching columns, filling blanks, no matter the place. But if you check a group of abbreviations, consider them. It's very important. And well, that's all. On Wednesday, we have our last theoretical class, and you have the chance to, you have the chance to to be prepared. These two presentations are similar to an introduction to the module 2. That's why it's very important to practice this vocabulary. Okay? Any questions? Something you would like to tell me? Okay, if there's nothing to tell me now, that's okay for me. We can finish the activity. And don't worry, tonight at 11, in 2 hours more, is gonna be the deadline for homework and everything is gonna be done. So let's go and let's keep on reading, okay? So have a good night and see you tomorrow in the last workshop. Okay, bye-bye.
Good luck.
Bye, good night. Okay, so stop this.